I will teach you now how to work through different levels of pain when you're doing your rehab. One thing to keep in mind is that our body heals specifically. And what I mean by that is if you take a needle and you prick your skin's going to heal the size of the needle and nothing more. So when you do the rehab, you want to work specifically where you have the problem and not do any extra movements. So that way your body will grow new cells exactly where you have the problem. Remember, our injuries cause muscles to become weaker, and you want to strengthen that specific area to be as strong as the muscles around it. And then afterwards, you can do more general strengthening. So whenever we do rehab, again, you want to keep the pain below a 3. And if you are rehabbing an area where you feel a lot of pain, then you want to be really careful. Listen to your body and really listen to the signals of pain. I will use my bicep as an example for this. So let's say I grab a weight and I start doing a motion and I feel a little bit of pain. That's okay to do. If I start to go higher and the pain starts to increase, my body's trying to tell me to stop doing that because I'm hurting myself. So at that point, I should listen to my body and then back off and then do the range and motion that my pain and symptoms allow me to, keeping the pain below a 3, doing 2 to 3 sets until the muscle gets really tired, and then leave it alone. And then with time, the muscle is going to get stronger and your pain levels are going to start to decrease. As they decrease, you can increase the weight, increase the motion, and start pushing yourself further and further. This becomes the easiest time to do rehab because you have less pain. There's less likelihood that you're going to injure yourself. You can start experimenting and doing more. Now, once your area of pain starts to get smaller, this is where the magic happens of learning how to do rehab correctly. Details and specifics make things go from good to great, and in rehab, this is what makes your problem from feeling better to having it completely go away. Once you can learn and master this skill, you can make some magic happen on making your problems and symptoms go away and disappear. So I will continue to use my bicep as an example. So let's say the area of pain that you have becomes really small. And let's say I do 10 minutes of rehab on that specific area. And I do a broad motion working my whole bicep muscle. That means I'm going to spend about 80% of the time working the healthy muscle and only 20% of the time working where I have the injury. So that means out of these 10 minutes, I'm only spending 2 minutes doing rehab specifically where I have the problem. And remember, our body heals specifically. So where I do the rehab is where the muscle is going to grow. But if you only go to the gym for 2 minutes, right? Can you expect any results? No. And whenever I ask this to anybody, everybody laughs because the idea of going to the gym for 2 minutes is absurd. But the same thing applies for rehab. If you're only spending actually 2 minutes out of the whole time you're rehabbing, you're not going to get any results. So what you want to do is you want to flip this time around and spend the majority of the time that you're doing the exercise working specifically where you have the problem to make your body stimulate growth of more muscle cells exactly where you have the injury. The way that this is going to look is that if I feel the pain here and I continue and then the pain stops and I don't feel the pain from this motion, I'm just going to work through the specific movement and range where I feel I have the issue, and I'm going to not do anything extra to spend the majority of the time focusing where I have the problem. Once you can do this, your body is going to grow much more new muscle cells there. This is going to get stronger faster, and your problems are going to start going away. Now, what will eventually happen with a specific motion is that you will get better, and then the pain will become less, and the area of pain will become smaller. So at that point, you want to change how you rehab to continue to chase the pain you have. As your pain improves, as it changes, you constantly have to change how you exercise to make improvements. So at this point, what I would do is I would make the motion go from that motion we did to more specific, to continue to work specifically where I have the issue, keeping the pain below a 3, pushing the muscle till it gets really tired to make it grow. And as you understand this process and learn and practice, you will get better and better at doing this. But this is the whole magic of rehab. It is very specific and detailed work. And once you understand this, you can make your problems go away.